and I'm going to walk you through some things. There's the directory in our resource library, the member guide, our resource drive, and other resources I'm going to show you here today. But we're going to start with the directory. When you open the directory here, you can see that we have over 700 contacts and profiles loaded. We load individual member contacts in here, folks who are members of our organization, as well as company profiles. Right now, as an organization, we are really heavy on profiles for skilled nursing facilities, and we are asking for folks to give us feedback on home health, hospice, and the other industries, and what criteria is appropriate for their profiles before we really start driving, gathering that information. So let's go ahead, and here in the search bar, it's going to allow you to locate providers based on services, insurances. You can search people by name. You can search for parent organizations. So for example, if you search Trilogy Health Services, it's going to show you all the Trilogy's buildings that are loaded into here. It's going to show you contacts who work for Trilogy. So for example, Nick Thompson. Here it's Nick Thompson. He's a hospital liaison for Mount Carmel and Ohio Health. He is a primary hospital liaison. He works for Trilogy Health Services. There's tags here on the profile to show you what services that he offers. There is an email address, a work cell phone number, a couple work addresses that he has, and again, listed off is the different services that he provides as an employee of Trilogy. So this allows folks to easily, at the hospital, or if you're a member of LOCA, find contact information, direct contact information. What we ask our members to do is, so after you fill out a membership application, once we process it, you will have a profile created in here. In the future, if you have a change of employment, we ask you to come in here and self-update your profile. So in the event that Nick no longer works for Trilogy, he goes somewhere else, Nick would log in here, he would hit the edit button, and he would update his information. Now, by default, it only shows you certain fields, so you may need to make sure you hit this icon here at the bottom, show more, and then it's going to give you more fields that you can enter information for. There's also the ability to change these tags. So in the event that you want to add tags or remove tags, you click that option and select or deselect based on what services are directly provided by the organization that you work for. So Nick, he's a hospital liaison. He could probably say, oh, I can do senior care advising. He doesn't work for a senior care advising organization, so he would not click that tag. Let's pull up a company profile. So let's look at Majestic Care of Whitehall. Majestic Care of Whitehall, they have memory care. They're a skilled nursing facility. They've got the ability to be tagged just like individuals. Here's the direct phone number for the facility. Here is a cell phone number for their hospital liaison, Taylor Harry. Here's their fax number. Here is the complex considerations. So we, as part of our SNF form, survey members based on the criteria that can make or break somebody accepting a patient from a hospital when they send a referral. So they consider complex wounds. They consider patients that require a secure dementia unit or unsecure. They offer in-house hemodialysis. They will consider patients that have used drugs greater than 6 months ago, and so on. So it allows the hospital case managers to much easier find services for patients based on these criteria. Same thing for insurance. There's a detail here that they frequently accept Medicaid only for short-term and long-term care. And so when you're looking for a facility, whether you're a hospital worker or if you're from a hospice trying to locate services, all you can do is you mix and match criteria in our search bar. So say you start with the service you're looking for. So you're looking for a skilled nursing facility. And then you can add different things on. We're looking for a skilled nursing facility in Franklin County. Here's the nursing facilities in Franklin County. We're looking for a facility that can do the hemodialysis. All right, here's the facilities in Franklin County that have the in-house or on-site hemodialysis, and we need one that takes Humana. So you see here, Wexner Heritage, they would be an option for those considerations. You can click on that and say, all right, Callie Demosky, she is their hospital liaison. That's who I'm going to give a call to. Now, we also load in if the facility has a separate, separate liaison. So you can see for McNaughton, there's more than one liaison, so both of their contacts are loaded, and a cell phone number is loaded for their admissions director as well, who also covers nights and weekends. So it makes it much easier for folks to locate services. Here they give us even more information. They have wound care MPs and PAs who round, wound care certified RNs. Here's the frequency of that their physician rounds and their physician's MP or PA. So really great information.